I would like to share some interesting scenarios in chronic lung disorder disease group. Some ICD-10 codes need pay attention to increase overall risk adjustment factor, RAF. In 2020 CMS-HCC model, the chronic obstructive pulmonary disease group contains 3 HCCs in the order of higher hierarchical orders, HCC 110, HCC 111, HCC 112. The chronic lung disorder group. The new HCCs, V28 HCC 276, lung transplant status/complications, and V28 HCC 279, severe persistent asthma, are added. Most HCCs in this grouping had minor changes, with the exception of V24 HCC 112, fibrosis of lung and other chronic lung disorders, which had several codes removed, and the rest dived between V28 HCC 278, idiopathic pulmonary fibrosis and lung involvement in systemic sclerosis, and 280, chronic obstructive pulmonary disease, interstitial lung disorders, and other chronic lung disorders. V24 HCC 110, cystic fibrosis, has all of its codes moved to V28 HCC 277, cystic fibrosis, with an increase in RAF of 0.488. V24 HCC 111, chronic obstructive pulmonary disease, had all of its codes moved to V28 HCC 280 with a decrease in RAF of 0.016. V24 HCC 112, fibrosis of lung and other chronic lung disorders, had several codes, such as sarcoidosis of lung, drug-induced interstitial lung disorders, respiratory conditions due to smoke inhalation or other specified agents, and other rare conditions, are removed, and the rest codes moved to V28 HCC 280, chronic obstructive pulmonary disease, interstitial lung disorders with an increase in RAF of 0.01. J84112, J84170, and M3481 in V24 HCC 112, fibrosis of lung and other chronic lung disorders, are moved to higher hierarchy, V28 HCC 278, idiopathic pulmonary fibrosis and lung involvement in systemic sclerosis, with an increase in RAF of 0.599. In 2020 CMS-HCC, Model J84112, V24 HCC 112, is superseded by J449, V24 HCC 111. But in 2024 CMS-HCC Model, J449, V28 HCC 280, is superseded by J84112, V28 HCC 278. In this scenarios, risk adjustment factor increase is 0.483. Please contact us if you need further information of the risk adjustment score calculation. Thank you.